Hi, so my name's Tina. I'm the cabinet member for Children, Young People, Communities and Culture, and I've been asked to chair this particular forum. So without further ado, I'm going to pass over to Will Godfrey, who I think is going to take you through our presentation, which is on the pressures that we will be having or expecting to have during this coming winter. So over to you, Will.
Okay, thanks, Dina. And for those people who don't know me, so I'm Will Godfrey, I'm the Chief Executive of the Council. And as Dina said, we want to spend some time tonight just talking through some of the sort of issues that we've been facing. So what we're going to do, if it's okay, is we'll talk a little bit about the vaccination programme, and I'm in a minute going to ask Jill from the CCG to talk about that. And then what we're also going to talk about is just some of the impact that we're still seeing from I guess the ongoing pressure that COVID is bringing. So from the perspective of the impact it's having on us, as well as it, people will have seen, I'm sure, media stories about shortages in supermarkets, pressure on the NHS, all of those issues. And from a local government perspective, we're facing exactly the same issue. So, we've had some really significant issues around recruitment and retention. We've had some pretty significant issues around workforce impact of people being off either directly with COVID or particularly over the last couple of months, families where, perhaps COVID has been caught by children and then staff having to take time off, etc., to manage the impact of that. So, we want to be very open and honest about some of the impact that's had on us and some of the potential issues we've got about some areas of service resilience over the next couple of months around that as well. And we'll talk specifically about some of the issues we've got in health, social care and some other things. And then we will touch briefly this evening on some of the context around the budget, both in spend for this financial year, but also as we're now starting to make preparations for the budget for 22-23. And I guess just to sort of keep the conversation going and talk about how we can work collectively together to do that. So without any further delay, I'm going to pass over to Jill May, who's going to talk to us about the vaccination programme. Jill.
Thank you very much. So you will all be aware that we're now in that period of time where we're really cracking on and giving the boosters. The boosters absolutely give that extra protection against getting the COVID-19 in adults, particularly over the age of 50. Having said that, though, as of this week, if you're aged 40 to 49, you can now start to book up for a booster. Second doses are also going to be offered to young people aged 16 to 17. This figure will have changed already since we started joining these meetings on Tuesday, with more than 37,000 boosters that have been given. I think it's also important to say that we really are focusing and targeting to make sure our residents in care homes and those who are housebound get that booster. So we've got outreach teams getting out there, working with primary care GPs and community services to make sure we get that booster to protect them. It's also, particularly for the Bath area, you may have seen in the press the successful campaign of the canal boat going down to the boaters. That's up and running again, and particularly making sure that those people sleeping rough or homeless are also supported. There are a number of weekly vaccination clinics that pop up, particularly on a Thursday, where we're offering appointments to students, staff and the wider public. Next slide, please. So this slide starts to set out, we have been on this programme since December last year, and I've said this on each evening this week. Had we known then what we know now, that this vaccine programme would still be going. Look, we've done this again. This number will have gone 1.6 million vaccines. That's predominantly the first and the second vaccine. We make reference to a word cohort in here, but that's what we call and name the age groups of people that have been invited. Interestingly, today, 50 people turned up at Salisbury City Hall, never having come forward for the vaccine at all. So we're really delighted that people are still considering it and still stepping forward to be vaccinated. Children aged 12 to 15 are also receiving their vaccination. This is being undertaken by the schools vaccination and the IMS teams. Virgin Healthcare are doing this. Again, it's surpassed the uptake. However, we're in a little bit of a lull at the minute because last week the guidance changed. So if a child was COVID positive, up until last week, they would wait 28 days until they had the vaccine. The government, rather the Joint Committee for Vaccines and Immunisation, have changed that you now must wait 12 weeks. That has now extended the programme where we will need to go back out and offer that vaccine during January and February. So as I said, we're closely monitored on just what we are giving. In a minute, I'm going to hand over to Corinne Edwards, our Chief Operating Officer, but I just want a little bit of a plea, if you could help us. The national message really went out as well to say, you know, you could walk in and get your vaccination. The public, and it's great to see, but they have taken us literally at that, walking in. And at the racecourse, on Monday, 250 additional people turned up to attempt to get a walk-in vaccine. Unfortunately, the demand means that all the appointments are taking, and whilst each site will work flexibly to offer, because we do have some people that do not attend, and therefore we have available vaccine, but we cannot manage it on that scale. And we've seen some very, very frustrated and angry public. We've also seen wonderful support for our staff, but it's just a little bit of a plea to say we still need to be patient. We know the government message was get your vaccine now if you want a Christmas. That doesn't mean you get your vaccine ahead of when you're eligible to, but just be patient. And if you book up through the national booking system and you cannot see a site close to you, keep trying. It just means those sites are full to capacity at the moment, but we are looking to get more capacity on board to meet now the increased demand. So happy to take questions at the end of it, but I will now hand over to Corinne. Thank you.
Thanks, Jill, and good evening, everybody. So yeah, I'm Corinne Edwards. I'm the Chief Operating Officer for the Baines locality in Baines, Swindon and Wiltshire CCG. And hello to those of you, the faces I recognise. Nice to see you again. So just following on from Jill, this is just to give you a bit of a sense of the pressures, and Will's already alluded to it in terms of the pressures for staff and recruitment and retention. But we are seeing, and as you will have seen through media, national and local, the current pressures on the health and social care system. And when I talk about the health and social care system, I mean right across all our providers, through from the IUH, through to Virgin Care, through to social care, and indeed through to the third sector. So everybody is feeling that increase in demand, and this winter is going to be particularly challenging for the reasons outlined in this slide. So as always, wintertime, you see increased respiratory infections, and we particularly have seen children with increased respiratory problems, but equally that affects adults as well. We've seen, as a result of the pandemic, delays in people seeking medical attention, and therefore, although emergency admissions might not be significantly up on previous years. We are seeing greater complexity of people being admitted with serious complaints. So that is clearly putting more pressure on services because of the level of acuity or seriousness of people's illness. People are catching up on more routine screening, which was delayed through the pandemic. So trying to make sure, certainly in primary care, that they're continuing to do all the routine activity. And as we know, the vaccination program has been running alongside all of these other demands as well. So increase in demand just generally for all services. And then the big issue, and this is one that I think worries a number of us, is the staffing, recruitment and retention, and making sure we're keeping our, the health and well-being of our staff at the forefront of everything we do. There are national pressures for staffing. It's not different or unique in Baines. We're seeing it mirrored here, and we're doing an awful lot of work around local work around how we do recruitment and retention, and trying to be creative jointly with partners around how we look at the key roles that we need, particularly for this winter. Next slide, please. So this slide really is about what you can do to help locally and get some messages and support our communications, of which jointly our communications teams have really been advocating all the access points that are listed here, but really importantly, encouraging people to think about how they can practice self-care and get advice from our community pharmacists. Our community pharmacies are a wonderful source of being able to get help and support for quite a wide range of issues, and often you therefore don't need to necessarily see a GP. It's obviously Think 111 first, which you can do online for health advice, or indeed to get a booked appointment. I'm not going to talk about the Community Wellbeing Hub because I know that's a slide later on, but as many of you will be aware, that's something that started in the pandemic, is renamed, and is a collaboration between Virgin Care and the third sector with the council and the CCG. So, but I'll leave that for a little bit later on. I think a really big message: look out for your neighbours and your family and friends. Keep an eye on people, make sure that they're okay. I was saying on the forum on Tuesday evening, when you live in a rural location like I do, it's important to just keep an eye out for one another and see what you can do for one another. And then if you have a life-threatening emergency, going to A&E or calling 999. What we are seeing is a lot of people using those services who really don't need them, which is why we're advocating all the other aspects of looking after yourself. And a really big message is, keep your, keep your medicine cabinet at home well stocked with the usual things like painkillers, anti-diarrhea tablets, ibuprofen and things like that. So there are things that we can all do to try and look after ourselves. The last plug on this slide, although not directly linked to what I've just talked about, is we're also engaging on the future health and care model for Baines, Swindon and Wiltshire, but equally for the Baines locality and particularly around the IUH. So this is an engagement survey, and we would really encourage you and your residents to really get involved in this survey. And I think Sarah might have just put the link as well in the chat. So I'll pause there and hand over to, I think I'm going back to Will.
I'm just thinking, Jill, if you've got to leave us fairly soon, it might be, if there are any questions at the moment about the vaccine programme, that might just be the right time to just pause and take those if there's any comments or questions, Dina.
Yeah, no, very happy to do so. If people want to speak, if they have mastered the art of clicking on their virtual hand, that would be great, because I can't actually see everybody on the screen at the moment otherwise. So I'm just keeping an eye on the, I'll also have a look in chat in case somebody wants to make a comment in there too. I'm not getting anybody who wants to raise a question right now. But can I ask a quick question,
Oh,
which
sorry.
is based on what you were saying about children and their vaccination? Is that delay also applicable then for adults as well? Do they also now have to wait for 12 weeks for?
No, so there's no change to the adults at all. So it's just specifically with children. So there's no other change.
Okay, that's great. Thank you. That's really clarified that for me. Anyway, so I'm not coming up, just so you've obviously done a fantastic job and everybody knows exactly what's going on. But I know that if people do have questions and they want to send them after you've left, then we'll make sure they get forwarded to you too.
Yeah.
So thank you.
Okay,
and if I
Tina,
don't
so
see
can
you, before you go, thank you very much for your contribution. So I'll be back to you now, Will.
Yeah, I'm going to pass over to Becky. Actually, I think Becky's going to take the next bit. Becky.
Great, thank you. Thank you very much. And it's good to see faces and good to see people on the call. So I've got a couple of slides and the theme of what I'm talking about is COVID. And so this slide on the left-hand side in the box, it gives an overview of where we are with our COVID rates. And our current Baines rate per 100,000 is 462. And if you remember, just a few weeks ago, it was right up high above 1,000 per 100,000. So it's really good to see that it has come down. It's still high, but it has come down a huge amount, which is really excellent to see. A lot of that is attributable to people who have taken on board precautionary control measures, worn face coverings, taken tests, stayed at home if they've been poorly, and had tests if they've had symptoms. So thank you to you and residents around for that as well. So our current rate is 462. It's been running around that level for about the past week or so with a very slight downward trend, which is good to see. The England rate is a little bit lower than Baines, it's 429, and that's been increasing very slightly the past 7 days. And the Southwest is higher than us at the moment, and having been increasing, that looks to be levelling off a little bit. In the hospital, in the RUH, we've currently got 33 patients in hospital, and they are a mixture of Baines residents and non-Baines residents with COVID. And the number of people in hospital with COVID has been between 30 and 40 for the past 2 or 3 weeks. So that's sort of been fairly constant and possibly is slightly decreasing. I think as we've all learnt with COVID and over the pandemic, things can change fairly rapidly, but it's good to see at the moment that we seem to be in a fairly stable position. The table on the right hand of the slide is a reminder to me to talk about the importance of us all testing ourselves for COVID. And that's because, as we know, up to 1 in 3 of us, if we have COVID, don't have symptoms. And the new recommendation that's just come out this week is about taking lateral flow tests just before times of high risk. So that's the new communication message that's coming out from the UK Health Security Agency. So if any of us are going to visit an elderly relative or someone who is ill, someone who's at high risk of getting quite seriously ill if they get COVID, then before going out to see them on that day, we're encouraged to take a lateral flow test. And also a good reminder that testing is important whether or not we've been vaccinated, because even if we've been vaccinated, we can still get and still pass on COVID. We're less likely to get seriously ill, which is the great news about the vaccine, but we can still pass it on and we can still get it. So these rapid tests can be picked up from a number of places. They can be picked up from the Bath City Centre on Bond Street, quite a few libraries, so Midsummer Norton, Keynsham, Bath One Stop Shop, Bishop Sutton, Timsbury and Radstock all stock the lateral flow tests, most pharmacies, and also you can order home kits at home, which I'm sure many of you will have done. And then we also have the outreach van. So that green van that looks a little bit like an Asda delivery collect van is our outreach van. And on the right on that table, on the slide, that shows our schedule for next week, places that van is going to go out and reach. And the van is part of a targeted approach to promoting community asymptomatic testing, specifically set up to try to reach priority groups who would be perhaps less likely or less able to get tests from those other venues that I talked about. So that's specifically aimed a little bit more at people who perhaps work in occupations that have got a high exposure risk, or people with disabilities or impairments, people who are experiencing homelessness or rough sleeping, or people with drug or alcohol dependencies. Also, the people who plan where this van goes, they'll be really keen to hear from yourselves if there are any other venues in the Somer Valley where we can organise with yourselves for the van to be there. So if you're able to let Sarah know of any particular venues, then we can, someone will make contact and we can look see if we can organise for the van to be there. If we could go on to the next slide, please. So this just second slide for me is just about what we know really. It's just reinforcing what we know and asking for your support to continue to encourage other people to follow these messages. Although COVID rates have come down, they're still high. And so in order for us to keep our freedoms that we have in our everyday lives, and we all want to enjoy and enjoy normal, getting back to normal and living our lives as we want to. So we need to keep COVID rates at a low enough level. And so we are encouraging all people to follow these processes. So to get vaccinated, as Jill's talked about, also the flu as well. We know that flu season will be upon us soon. So if you are eligible for flu vaccine, please do take up that offer and encourage others to as well. Wearing a face covering, and there's been more evidence come out recently that suggests that face coverings are even more effective than we previously knew because of lack of evidence in reducing the risk of COVID. They protect both the person who's wearing them and if from getting COVID, and they also restrict the amount of COVID respiratory particles that people breathe out if they do have COVID. So are encouraging face coverings. We've covered lateral flow tests. If people have symptoms, then encouraging people to stay at home and take a PCR test, and people can book that online or phone 111. Let fresh air in, outdoors is safer. And I know that's difficult, isn't it, when it comes to winter? And certainly when we're having meetings, when we do meet face-to-face in work, we're all encouraged to bring along a blanket, an extra jumper, an extra layer, because we know that periodically we need to have the windows open just to be able to waft out the virus particles that may be in the room if someone has COVID. And finally, the public health team in particular and other parts of the council are really gearing up to try to support businesses and shops and entertainment venues more, and encouraging businesses to put up posters so that it creates a sense of the normal thing to do when people walk into a shop or an entertainment venue is to put on a face covering and is to sanitize their hands. So we're working more closely with businesses, and a lot of businesses are doing that. But again, if you're able to encourage, or you work in businesses, if you're able to encourage those practices, that would be great. So that's it from me. Thank you, Will. I'll hand back to you or to Dina. Thanks.
Okay, thank you. So I just want to spend a bit of time now talking about the pressures in terms of the budget, and just to give you some context, because we'll, as I said, we'll start very soon on the 14th of December. There's a briefing about the 22-23 budget, but it's important, I think, to reflect a little bit on the pressures that we've had in the last 18 months or so, which then will explain some of the other issues around the pressures on services. So if you sort of rewind to April, May 2020 and just think about the sort of the structure of the council's finances, it's important to recognise that from a Bath North East Somerset perspective, there are two things that I suppose exacerbated the pressure for us. So one is that relative to other authorities, we generate a lot more income to support our service delivery than other places. So particularly from three sources: from car park income, from our commercial estate income, and also from our heritage services, so particularly around the Roman baths. In a good year, I suppose we're probably generating £45 million worth of income from those three sources. And when the pandemic first hit, it's pretty clear that a lot of that income just sort of disappeared. So in 2021, we probably lost £30-odd million worth of that income. And obviously, when you're faced with that situation, that's a pretty challenging position to be in. When you also add on the fact that we're generally speaking a lower funded council because of the way that the government funding works, we were faced with some really very challenging circumstances, particularly in that early part of the pandemic, sort of April to June, July time, 2020. so we had conversations with UK government department, and as part of that, part of the work that we did with them, brought forward the UK government package, particularly to support income, and we also put in a financial recovery programme that was agreed in July 2020, that again put forward some savings internally that we tried to make sure had as little impact as possible upon services, but really sort of, fundamentally shifted the way that the financial foundations of the council are built, really. So actually, as we went through 2021, what we did find was, because we took that action early and we had that support from government, and then there was more sort of dedicated sort of grant support, we actually ended up in 2021 with a balanced budget position, and we were also able to top up our reserves that have helped us to manage this financial year, because a lot of the government support came to an end in March 2021, although some of it's continued into parts of 21-22, but pretty much all of that support will be gone when we're then faced with setting a budget for 22-23. So what we've been doing over the last sort of few months is getting ourselves back to a position where we've got some stronger financial foundations, and also thinking about how we do rebase the budget. So when we come back to some sort of level hopefully of normality, we're in a strong position as possible. And because we took that action early compared to other authorities, we're actually in a much better position than lots of other people are. So part of that has also been around trying to modernise and future-proof frontline services. So thinking about how we can use technology more effectively, just thinking about how we transform some of our other services, much more focused on some of that's been about taking some of our services back in-house. Some of it's about, as I say, using technology more effectively. Some of it's just been around, just generally speaking, working more efficiently. And that's helped us. We're not wholly through that process, so we've still got some work to do around that, and that will certainly continue for the next 18 months, 2 years or so. And we're also looking at different areas where we can potentially generate income that will then obviously help us, and try to make sure that there is as least possible disruption to the services that people receive. So if we just move on to the next slide, please. So as I said, not only have we had that financial challenge, but we've had the practical challenge as well of some issues around staffing, particularly supply chain. And as I said, you can walk into any supermarket in the country at the moment, and you'll see similar impacts on other businesses. So this is just an example. At the end of September, we were faced with an increase in our costs for our street lighting, which have added about £400,000 worth of extra spend in this financial year. Now, we can't just sort of say, oh, forget about it, we won't have electricity, therefore we won't put lights on. That's something which is a practical cost which impacts on us, which we have to deal with. So when that's just one example, and there are more examples of pressure that's in the system that is certainly having quite a significant short-term impact. We don't think those are structural issues, but that's one of the reasons why certainly myself and the leader made some public comments at the beginning of September, really to alert people to the fact that over the winter, we did have some. It was right to signal the fact that there are some resilience issues in the short term. So an example of that has been the shortage of HGV drivers. So that's had an impact on some of the resilience of our waste and recycling service. So people have seen some of that. Again, we're working very hard to try to work through the impact of that, but this is just an example. Pre-pandemic, you could train somebody to be an HGV driver in probably 3 to 6 months. Now it's taking probably 9 to 12 months. So, you know, sometimes it's not just the availability of the people, it's the process you've got to go through. So we're absolutely clear we need to prioritise frontline services. We will continue to do that, and hopefully the impact will be as limited as possible. But, you know, it's important that we keep everybody updated, and particularly now as we're going into season where we're starting to get more adverse weather. So we know that there's a storm warning for this weekend. It's starting to get colder. I'm sure we'll start to potentially see snow, etc. That's an additional pressure now on the services that we're trying to deliver. So, you know, we're just trying to be really clear about that. So we will keep people updated, particularly through the website and social media, and just, I guess, appeal as well for people's patience and for everybody to help that communication message to, you know, to communities and to service users. It's not the fact that the council's inefficient. It's not the fact that we're not doing things the way we should be doing it. It's the fact that we are under very intense pressure, like many other parts of the economy, and we just want to be very upfront about that. So that's that bit. I think we're going to move on to the next slide. I think it's about climate emergencies. So Dean, I think pass back to you.
Thank you. Yes, I was wondering, I thought Sarah Warren was going to be here, but I don't see she has come to the meeting. So I don't know, Tim, if you wanted to pick this up. So Tim Ball is one of our cabinet members, and if Tim might be having some problems in fact, I can't see Tim anymore. So I will now pick this up and I will talk to this slide, which is, you know, quite simply what we're doing here is we want to encourage everyone to keep recycling as much as you can, to help our teams by sorting out your recycling. I think you can now get several green boxes, so you could, if you wish to, if you have sufficient recycling, have one for every type of recycling you do. But failing that, if you can at least separate out your you know, sort of say tins and foil into one, and then your plastics into another box, that really does help us, and it keeps the service going around quickly and efficiently, which means that we're more likely to get round and get it done on the day that we say we're coming round to do it. And then, you know, it's other, you know, encouragement is to minimise your packaging, flatten your cardboard for collection. You know, perhaps use a small child to jump on your cardboard and get it flat so it goes into your blue bag. And it's really also just to remind everybody, I know that we announced this last year, but some people may have missed the announcements last year. We can't actually recycle wrapping paper because it often has glitter or, you know, other things in it, which just is a real challenge for us to recycle. So you can use other things, be a bit more inventive, use brown paper, possibly some textiles. You know, I'm sure I've seen lots of those lovely crafty programs where people have wrapped up things in much more personal and exciting ways. And then, you know, the last point here on this slide is around making sure your homes stay warm, but actually don't cost you a lot or the earth a lot as well. So have a look at our Energy at Home website, and, you know, keep doing what you're doing, because our recycling rates are pretty good, and, you know, together we'll be able to tackle the climate emergency this winter, but also as we move into spring and then throughout the next year as well. So everybody playing their part. Can I have the next slide, please? So as many of you will be aware, we've formed a fantastic partnership with our community, various community sort of agents. So we had our Virgin Care, who are our, one of our health providers, plus also the 3SG, which is a combination of the third sector groups, so voluntary organisations, and of course the CCG and the council. So we formed that relatively early in the pandemic to provide much needed support and help for residents who were struggling for a variety of reasons. It started off as a very simple place to contact if you were needed emergency food, but it has sort of morphed and been shaped into something that is so much more than that. I think there's somewhere between 200 and 300 organisations that are involved in this, and so if you are struggling for whatever reason, give the hub a call. The number's on the screen. It's 0300 247 0050, and you will only have to make that one call, and they'll be able to make sure that your needs are being addressed, whether or not that's accessing food, if you're feeling isolated or lonely, to even looking at perhaps employment issues, housing issues, etc., etc. So yeah, don't feel that you need to suffer alone. Give us a call and let us help you. So the next slide, I think. So this is our social media slide. So these are all the various social media channels that you can access council or CCG or other partner information on. So you can follow the council on nextdoor.co, use Twitter, Facebook, etc. All of these other social media platforms. I don't think we're on TikTok yet, but perhaps that's something we could get involved in. Or if you've got some particular splendid things you want to share with us, then please feel free to copy us into that as well. And I think the very last slide is the discussion slide. So this is where we really want to hear from you. Obviously, if you've got questions on what you have heard, then I will give you a few minutes before we go into the discussion. But the main thing we want to hear about is to hear from us about what is happening on the council, on the CCG. So what we want to know is, are there other winter pressures in this area that we might not be aware of, or that you want to at least make sure we are aware of? And then the second question is around the forum and its networks to help build on those strengths to help us all get through this winter. And I know that everybody, just referring back to the community wellbeing hub, everybody's done so fantastically well in supporting each other over the last 18 months. I think it is just a real credit to this area in particular that you've all pulled together, and so we just want to build on that as much as we can, so we can continue to help and support our collective communities. So can I ask if you have something you want to say, that you put up your hand, if you can click on the button, but I will also keep an eye on the chat in case you find it easier just to say you want to speak in that. But as all the slides have gone down, there is even a third option. You could just put your hand up if that is simpler to do. I think I've stunned you all into absolute silence. Either that, or I've been on mute for a really long time, and actually nobody's been nobody's wanted to tell me. Okay, so I'm not seeing any hands going up at the moment. I just wanted to make you all aware that, as you know, this meeting is being recorded, but we're also we've put out lots of information in the chat as well, lots of links to other websites and to some of the things we've been talking about. So we'll make sure that information is circulated to everybody following this meeting as well, so that information isn't lost and you don't need to hastily write down that information and try and get that all down as well. So that will be made available to all the attendees of this meeting. And in that case, then I'm going to, so if people do think of other things that they want to raise around winter pressures, then please let us know, and we'll make sure that we take that into account as we move forward into the winter. But I've also been reminded of some questions that they may be particularly interested in. So the first is around wants to understand how supported bus services can be improved. So I know this is an area which is very reliant on its bus services, so it would be really helpful to take part in that consultation. So the details of that are on screen at the moment. Otherwise you can go onto the West of England's website and take part that way. And the other consultation, again a bus related consultation, is on the A367 and A37 routes, and we're working with WECA to make sure that our so it's gone very dark, not quite sure why it's gone so dark, so I hope you can still see me. Yeah, so it's just to say that that's also another consultation which is on better bus services and also how we can encourage more walking and cycling along those two routes too. So I'm just going to go and see if I can turn the light on again and give you all a few minutes in case there's any other questions, any other comments anybody wants to make. Okay, I'm back in glorious Technicolor again. So literally somebody came in and turned the lights out whilst I was sitting here. Okay, so I'm not seeing any comments, I'm not seeing any hands going up. So in that case then, I think, unless anybody wants to suddenly tell me otherwise, in case I've missed anything else out, that we have come to a sort of natural conclusion of this meeting. So can I say thank you very much to everybody for your attendance, and I hope you have learned something of the pressures that you know, we as a council and our health services are under, and I hope we can continue to work with you in future months to make sure that all of our residents don't miss out on any support or any assistance because of pressures that I know that we're under, but also I'm sure many of the organisations that you are maybe involved in might be under as well. So on that note then, I think I shall declare this meeting over. Thank you very much and good night.